Hi, I'm Ann Peterson. Welcome to Health Perspective by Blue KC, featuring advice from experts on a variety of health topics. It's a place where you'll get the direction you need to make good health choices. Today, Dr. Loretta Britton is here to talk with us about children's health. Dr. Britton is a pediatrician and a medical director at Blue Cross and Blue Shield of Kansas City. Thanks for joining us, Dr. Britton. We could cover so many topics on children's health, but let's narrow it down to your key suggestions for promoting healthy choices in lifestyles for children.
It's a pleasure to be here, Anne. I think what we would focus in, first of all, is providing a loving environment for our children. Secondly, a healthy lifestyles focus in families. Thirdly, prevention. Fourthly, making sure that there is a medical home for the children and for our families.
Well, let's start with how to create a loving environment for our kids. What do you suggest?
Loving environment translates into being nurturing and supportive. Our objective, of course, is to nourish the child both in terms of physical development, moral development. We want to certainly deal with emotional development. We're trying to make productive young people who will contribute to societies, and that's the family's focus.
The next topic is rather challenging for parents. How do you get your kids to eat their fruits and vegetables?
Parents bring the food into the household, and parents serve the food. And so the key there is offer fruits and vegetables very early. It's always a part of the natural nutritional development guidelines for healthy babies, and it has to continue as such.
What are the long-term health benefits when children develop those healthy eating habits early?
I think probably prevention, avoidance of what everyone is concerned about right now, Anna, which is obesity. And associated with it are a multitude of health problems. That includes, we're seeing problems that we never saw before in children that we used to see solely in adults: elevated blood pressure, problems with self-esteem, anxiety, and depression. Obesity also brings upon certain concerns about cardiovascular health-related issues as well. Diabetes has been off the charts for our young people, the type 2, adult, what used to be considered adult onset diabetes. So we definitely know that what we're looking at is a compromise of our children for their lifestyles as well as their lifespan. And that's a big concern. It's the very first time that we can probably anticipate that our children won't live as long as their parents.
What about exercise? Any advice on how to get kids to spend less time playing their video games and more time being active?
Parents must be role models. Children do what the families do. And if the family promotes an active lifestyle, children will be very, very active.
We all want our kids to be safe and healthy. So what are some of the basic preventative steps that we can take?
Clearly, we've all heard about all of the mandates for wearing helmets and seatbelts, but there are none for really making the household safe. Children fall, and children are curious, and so you must do those things which protect them from their healthy curiosities so that they are not inadvertently exposed to poisons and other detrimental products that are found in the home. And we also want to make sure that if they do fall, they land on a surface that is appropriate to land on. So sharp edges, etc., may sometimes be looked at differently for a toddler, furniture, etc., than it would be, for instance, for a young adult in the home.
As a pediatrician, how often should a parent take their child to the doctor?
That varies with age. In the first 2 years of life, there may be several visits, and these are all timed in with the immunization schedules. Secondly, and most importantly, however, is a familiarity with your physician who will assist you in doing what we call anticipatory guideline monitoring, so that you know what to expect, what you should be looking out for to monitor the wellness of your child for natural and normal growth and developmental milestones being achieved.
Well, thanks for joining us and this wonderful advice that you've given us. So to recap, you suggest creating a loving environment for your child, encouraging healthy eating and exercise, practicing prevention, and also getting to know your child's doctor.
That's absolutely right.
Thank you, Dr. Britton. Thanks for joining us today for Health Perspective. For more information on children's health, visit the Education Center at bluekc.com. Be sure to come back next month for tips on another health topic, and register on bluekc.com today to put yourself on the path to better health.